I think I have a prolapse. How would I know and what can be done about it? Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. This is Justine Calderwood, pelvic floor physical therapist and birth recovery specialist. We're diving in a little deeper into the subject of pelvic organ prolapse. And we've done a series of these Ed Talks trying to break it down a little bit. So hopefully you've caught our first video where we just talked about some of the general symptoms of prolapse, what kinds of prolapse you might have, and then we broke it down even more into the anterior wall prolapse, which is a cystocele or of the bladder, and also the posterior vaginal wall prolapse, which is a rectocele or of the rectum. Today I want to give you a little information about uterine prolapse. Let me grab my little model here. This is a female pelvis. So as we're looking at it from the front, we see the pubic bone here, and from the backside, the tailbone. And we can see the pelvic organs as we look down in here. So right behind that pubic bone, you have the bladder, you have the uterus, and you have the rectum back there. So the uterus can be another organ that can prolapse. And what a prolapse means is just that it can descend down out of that position of what we would expect it to be, where it's held up. And that can happen from changes in the pelvic floor area from below in the support system, but also from pressures coming from above. So a uterine prolapse is basically where the uterus has fallen down to some degree. So what symptoms might you be experiencing if you have a uterine prolapse? It's actually kind of a combination between the front wall, the bladder, and the back wall, the rectum. So some symptoms that you might experience are pressure or heaviness down into this pelvic area. You might have some achiness into the lower abdomen or into the pelvic area. It might even feel like something's kind of bulging out or coming down along the vaginal area or even the rectal area, where it just feels like, some people describe it like it feels like there's a tampon that's sitting a little too low. I've had people tell me it feels like almost their baby's head is sitting there, even though they know they've already had their baby. So it can feel like that. Some other things that you might notice if you have a uterine prolapse is not being able to completely empty your bladder. So you might go to the bathroom, and then within minutes of having just gone, you feel like you have to go again. And it can also happen with the bowels, where you feel like you're not completely empty in your bowels, where you get some out, but then you have to go back into the bathroom and finish up. It can feel like lower back pain. You might have that, and that might be your only symptom. You might have constipation, and again, just a feeling of fullness into this pelvic area or lower abdomen. So you might be thinking, okay, Justine, I have watched your videos. How do I know if I have a bladder prolapse or a rectal prolapse or a uterine prolapse? The thing is if you're having any of the symptoms that I've talked about in these videos about prolapse, go get it checked out and find out. It's beyond the scope of this video to go through that with you, although I am planning on doing another TED Talk on how you can do a self-check at home. So if this intrigues you, please look for that video and see about doing a self-check. So my point is, if you are having any of these symptoms and you suspect, get it checked out. Go to a professional that's trained in being able to assess for prolapse, to tell you which organ or organs are involved, and to guide you in actually getting better. Because it's one thing to know, yes, I have a prolapse, but it's another thing to know, what do you do about it? And I want to hopefully set you up for success with that, because a lot of people feel like it's a death sentence, that, oh no, I have this prolapse, now my life is over, I can't exercise, I can't be active, and they get really fearful. They're not sure if they should be lifting up their child. They're not sure how much pushing or pulling or lifting or anything, and it becomes really hard to even live life with everyday things. So please don't go down that path. If you suspect that you have a prolapse, get it checked out. In my opinion, because I'm a pelvic floor physical therapist, I think going to a pelvic floor therapist is the best option. Now, you can go and check out your primary care physician, go to your OB/GYN or your gynecologist, or even your midwife, and they will help guide you. But really, physical therapists that are trained in the specialty practice of pelvic health are really a great source of information, because we can assess and tell you, okay, what's going on, and also give you that guidance on what can be done after the diagnosis is made. So real quick, I just want to tell you about some of the options that are available for treatment that are conservative options. So one thing I want to reiterate is that even if you do have a pelvic organ prolapse, surgery is not the only answer. And for many people, surgery isn't even the answer that they need. They're able to manage it, they're able to learn what they need and get better and even asymptomatic, meaning not having symptoms, with conservative care like physical therapy. So what do? One, we can do exercise. So while Kegels and pelvic floor strength is important, it's not the only piece of the puzzle. Yes, we want to make sure that those muscles are strong and that they're coordinated, but also we want to make sure that those muscles relax when they're supposed to and that they're not just overworking. Exercise in general, we want to make sure that the hips and the legs are also strong and the core, and that includes not only the abdominal muscles, but also that you're breathing in with your diaphragm. So that's some of the things that we go over in conservative care. Another thing that we would cover is posture. It's really important that a lot of moms are still in this kind of like pregnancy posture where their rib cage is back, their tummy is still kind of out here, and they're really arched here in the lower back. So how can we get you out of that position and get the hips underneath you and the rib cage stacked on top where we're not putting a lot of pressure into the pelvic area? So posture is very important. There's conservative things like pessary use. Now, physical therapists don't prescribe them, we don't fit them, but working with a urogynecologist a lot of times, or a urologist, is a good option if a pessary is something that you're interested in using, whatever that looks like to you. Some people use a pessary for certain activities. Some people use a pessary and wear it all the time. Basically what it is a support device that goes up into the vaginal canal and can support the organs from below. Another option is using something like support garments. So while something like compression leggings, something that's nice and supportive, can be used, also Spanx that can support and give a little bit of pressure to help you be more aware of that pelvic area and give a little support there. So Spanx is a pretty inexpensive option that you can try. Another thing that we have here are the FemJock. We have these in stock just for fitting. We don't actually keep them to sell, but this is a support garment that can be used underneath your clothing, but over top of your underwear. And it's got some nice supportive it's got a nice supportive area here for the perineum and for that lower abdomen and around. So we have different sizes here at the Healing Spot. So if that's something that you're interested in pursuing, not everybody is going to choose to do something like this, and not everybody is appropriate for this. But for some people, what I have found, especially early postpartum, where they're really kind of feeling like they need some support and they're actually physically using their hand, this can be a really good option. Before we end this video, I want to tell you what you can expect with an assessment for pelvic organ prolapse if you go to a pelvic floor physical therapist. So we typically check in different positions. That might be lying down, it might be standing, it might even be with a squat. And typically in those positions, we may have you first just be at rest. So if you're on your back and you're just lying there on your back, and we're doing a pelvic assessment, what we may do is, I'm going to use this model here, we may actually open up the labia and just look for any bulging tissue right there at that vaginal opening to see if we can see anything, okay? And then we may feel, so we would of course be gloved up with a glove, and we could feel into that vaginal opening just at rest to see if we can feel any bulging tissue. Then from there, we may ask you to cough or like fake a laugh in order to increase pressure into this area to see if anything changes. So again, with that increase in pressure, we may look, we may feel. Then also we may ask you to bear down. So that might be simulating almost like you're having a bowel movement. What I like to do with my patients is have them blow up a balloon. So it just kind of simulates that increase in pressure and bearing down to, again, see if I can feel or see any bulging tissue. Again, we could do that lying on the back, standing up, and even doing a squat. So that's what you can expect from a pelvic floor physical therapist in checking for pelvic organ prolapse, so we can know which organs are involved, if any. So there you have it. We went over what symptoms you might have if you have a pelvic organ prolapse, in particular a uterine prolapse, We talked about some conservative treatment options and even what to expect if you do seek out help from a pelvic floor physical therapist. If any of this applies to you and you suspect that you have, or maybe you've even been diagnosed with a uterine prolapse and you're here gathering more information. If you want a little bit more guidance, please head to our website, healingspotpt.com. Fill out a request to do a discovery session with myself. It's basically a one-on-one consultation, either sitting here in my office, just right over here in this chair, in this space, or we can do that online via a secure video. And I would be happy to answer any questions that you have, talk about what you're experiencing, and maybe even what treatments you've tried so far, if any, and guide you into the next steps. Thank you so much for watching our Ed Talks. Be on the lookout. I'm going to be making another video on prolapse on how to do a self-check for pelvic organ prolapse. I'll catch you on the next video.